Good evening and welcome to another episode on iMed, today also from Channel I. And today we're going to talk about the issues or the health problems related to your digestive tract, your gastrointestinal issues. So to do the honors, we do have with us today consultant gastrointestinal surgeon Dr. Ranil Jayasena. Good evening to you, doctor.
Good evening.
So gastrointestinal diseases such as gastritis and other diseases that are very common in the society. So we are going to take a look first at what are these diseases which are related to our digestive tract.
Yeah, as you said, gastritis is one of the very common gastrointestinal problems, not in Sri Lanka, all over the world. There is a clear reason for it, because it is mainly related to food and drinks. Then we can't live without food or drinking even water.
Yes.
Therefore, the main causative factors are related to this problem. Therefore, it is very common. Gastritis means inflammation in the stomach, because gastric means it's a Latin word. Inflammation of the stomach mucosa actually. But various people give various definitions, but the main problem is the inflammation in the mucosa. The causative factors are actually different. Mainly it is related to food and drinks, whatever the contents you get there, but other than that, mental stress and tobacco and alcohol also play a very important role. Actually, irrespective of the age, you can get gastritis. Now, those days actually it was common among adult and middle age group, but now even among children it is a common problem. Now, actually it is related to the food habits and sometimes economic problems, social problems and mental problems. But fortunately, the latest technology help us to detect those causative factors, and we are able to treat with the proper medicine and sometimes the proper surgery.
So doctor, that being said, with regards to the causative factors, what are the methods to identify or to diagnose gastritis?
Yeah, there is a very special instrument called endoscope. Those days we had to use a metal scope, which was little cumbersome. But now we have I will show you the instrument.
Yeah. Now we'll be able to see the endoscope.
Yeah. You can see the endoscope. It's a very flexible instrument, and it can be done in the OPD. It takes about 4 to 5 minutes maximum, unless you do some sort of therapeutic procedure to diagnose and find the cause. It takes only very short time, and also we can find the causative factor as well. No, not only to witness the ulcer or the other bleeding problem or other complication. Other than that, we can find the exact cause. Now, the actually most important and common causative factor is a bacteria, Helicobacter pylori. Now, when you go inside with the scope, now we know the features, clinical signs and other features of the inflammation due to Helicobacter pylori. But if you are not sure, and you can take a small piece, we call it biopsy, and also you can put it under the microscope and find the bacteria. Then we can actually target that organism and treat. Therefore, it is actually that technique helps us to save lot of lives. I think, Natalia, you may remember those days, it was actually, when you said the gastritis, it was sometimes
patients thought that it is incurable.
Incurable and can even die. but we rarely see death due to the gastritis problem because of this technique, and we are now treating the exact cause. And also the other problem is reflux disease. Now, reflux disease and gastritis actually can go together, but causative factors may be different to each other. You know, sometimes the inflammation in the stomach mucosa is mainly due to some ingredients in the food or drinks, irritants in the food or drinks, or smoking and alcohol, and sometimes medicine, where you take for the backaches and painkillers mainly, and also some other drugs also can cause inflammation in the stomach and gastritis. But reflux is a different issue because it is due to the relaxation of the muscle, and there are different causative factors for that.
So, the presentations are also different, or
sometimes, you know, very difficult to differentiate. But if patient comes with heartburn only, heartburn and some burping like thing, we know that it is reflux disease. But if it is confined to the stomach, epigastric region, the stomach, and burning pain and bloated feeling, we call it dyspepsia, and then of course it is pure gastritis. But we find in patients those symptoms in common. Therefore, but when we go inside, you may not see lesions in both sides, but you may see. But because of the gastritis that itself, sometimes you get this gas developed, and that gas forcefully going out, not due to relaxation of muscle, but because it is so full, it force open the sphincter and come out. Therefore, sometimes we get confused. But the answer is endoscopic examination and finding the exact cause.
So, what is going to happen after these findings?
Yeah, depending on the cause, I think if we think that it is due, it could be due to bacterial infection, and we can treat and we can kill the organism actually. We have a lot of medicine present day, and also but the lesion is mainly due to the acid secretion, because the mucosa get weakened due to the bacteria inflammation, but the acid secretion only cause the erosion in the stomach. Therefore, we have to reduce the input acid secretion. That there are various drugs called antacids. You know, various types. Now we get different generations, and therefore we are lucky in that sense also. We can treat the patient with antacids, and that usually acid can be neutralized by buffers. That is the basic knowledge we have. Therefore, sometimes that basic drugs are there, aluminum hydroxide, magnesium trisilicate, like that. And also you can block the secretion at the cellular level. That those are called proton pump inhibitors. Those are very famous drug category. And also H2 receptor blockers. There are some medicine related to that. Therefore, we have a lot of medicine now. That is not an issue. But as a surgeon, now our problem is the reflux disease. Now, sometimes very difficult to treat with the antacids and those basic drugs. So, if there is a inflammation due to bacteria, of course, that is a different story. You can kill the fellow and get rid of it. No. But the thing is, reflux disease is actually related to the anatomical abnormalities also. Now, anatomical abnormalities means, the reflux is prevented by a sphincter at the gastroesophageal junction. Now, sometimes sphincter doesn't work. In that case, of course, we have to strengthen the muscle by some medicine, they are called prokinetics. But when there is anatomical abnormality, it is like hiatal hernia, where the stomach is pushed into the thoracic cavity. The sphincter, that junction, displaced, in where there is no function. In that case, very difficult to treat because we have to correct it anatomically. Now, of course, we have facilities to do that also. It's called, there's a surgery, anterior or posterior fundoplication. Now, I will show what we see when we do endoscopy.
Yes.
Now, you can see some erosions. Actually, this is a very severe sort of gastritis where the bleeding also occurred. We call it hemorrhagic erosions. That patient can end up in anemia. If you don't detect and don't treat it, it will go on for a long time and slow bleeding and cause anemia. You will get confused why this anemia. And now you can see this picture where there is a linear sort of severe erosions. And you can see a hole like thing there, because actually it is not closing, that is the other sphincter where between stomach and the duodenum. Now that in this case that sphincter is weak. May be due to bacterial infection in the duodenum, because this sphincter is formed by the duodenum itself. Now, when there is inflammation in the duodenum, it is paralyzed and it gets dilated. When it is dilated, it can't close. Therefore, here what happens, the bile which is supposed to go down in the small bowel to help in digestion of fatty food, these reflux back into the stomach. Now, that is why you get these erosions, and patient get lot of pain and loss of appetite and sometimes vomitish feeling, and this bile even can come to the gullet, and also acid can be mixed with acid and cause problems in the sinuses and larynx. The patient can get laryngitis, then they go to the ENT surgeon, then ENT surgeon they also detect sometimes these things could be due to reflux disease and all that, and they have to treat post reflux disease as well.
So, after how long these kind of complications can occur?
That depends on the severity of the reflux. If reflux more, even within 2-3 months you can get that. But if there is a slow reflux, of course, it may take about 6-7 months, sometimes years. The patient may not develop symptoms for a long time. Then after that, when they develop symptoms and come to us, we may see this sort of picture also. And the other thing is reflux disease that could be due to some other causes. The ingredients in the food, where it causes relaxation of the muscle. Now, for example, chocolates and mites. Mites, you get 5-hydroxytryptamine, and cocoa in chocolates, and caffeine, and alcohol, tobacco. All these things can relax the muscle. Therefore, reflux becomes worse. Therefore, patients who have reflux disease should avoid that. And also the other thing is, when the muscle is relaxed, there is a problem with the sphincter. When you lie down, lie flat, when you sleep, this automatically these muscles also get relaxed. No? Then of course what happens, this food or some residual food or acid or bile which has refluxed into the stomach can get into the gullet and also to the upper pharyngeal respiratory system. Therefore, we advise these patients who have those symptoms to sleep in a little elevated position.
Maybe a couple of pillows.
not pillows. Those days we used to ask to take pillows,
sad.
but it is wrong.
Wrong.
It is wrong because when you take 2-3 pillows, the body get bent. Therefore, if unfortunately the patient had hiatal hernia problem, his stomach get pushed more into the chest cavity. Therefore, now what we advise to elevate the head end of the bed, put in some block stones or some timber, whatever it is, some sort of thing to get it's elevated about 4 inches. Then it will help to minimize reflux disease. And tobacco and alcohol, obviously those are not good even to anything, even to the mucosa of the stomach or to the sphincters, everything get damaged. Therefore, we advise them not to consume those things. Another thing is mental stress. Now, how does it affect the stomach is through the nervous system, because the stomach and the brain, there is a connection with vagus nerve where the acid secretion is operated. Therefore, when you have a mental stress, the vagus nerve is overstimulated and there is a hypersecretion of acids. Other than that, they have described there is a ischemia to the mucosa, the wall of the stomach, inner wall, because blood vessels they are going to spasm. Then blood supply also get jeopardized. In that case also, the mucosa can get easily damaged with even minor irritant thing, maybe chili, raw chili or spices and all that. When the integrity of the stomach mucosa is breached, even minor irritant can cause erosion. Therefore, it is patients are advised to
avoid these.
Avoid spicy food and chili, especially pepper and all that. And those are the main causative factors. Actually, now past few days, during this lockdown time and all that, people had to get down some food outside. They had to change their life habits and all that. Therefore, actually, this problem occurred more because they couldn't guarantee the hygienic situation of the food. Bacterial infections were more, and a lot of patients actually attended hospitals for treatment of gastritis and reflux disease.
So, doctor, what about the time of our meals? Like some tend to take it very late when it comes to the breakfast, and the time period between two meals.
Very important, because now why there is breakfast, lunch and dinner like this? Because you get hunger contraction during that time. Not only human beings, even animals.
Yes.
Right? They get hunger pains, hunger contractions 3 times a day. Therefore, mainly morning, noon and evening.
Yeah.
That's why we call it some breakfast, lunch and dinner you should not avoid. That time the acid secretion is at the maximum level. If you don't eat or drink something that time, if the concentration is more, and it can affect the stomach badly. Therefore, when you get hungry, you should at least drink some water to dilute this acid. Suppose you had some problem due to other tablets or bacterial infection or mental stress, some breach, some breakdown in the integrity and of the mucosa. That time, when there is acid secretion, if you don't dilute it, then you get that problem. That's why we say you have to have some meal 3 times a day, but we can tell, but whether people can practice it, I don't know.
Yes, some tend to fast.
Some other problems, economic problems, there are people who can have only 2 meals a day or 1 meal.
Yes.
But ideally, as a doctor, knowing these physiological factors and anatomical things, we have to advise 3 meals is a must to avoid getting gastritis.
Also, and that is being said about gastritis, and we also spoke about the reflux disease. Doctor, what about the hernias?
Yeah, the reflux disease is sometimes related to hiatal hernia, where it could be due to obesity. When the abdominal wall is too thick, the intra-abdominal pressure is very high. You know, you may remember the Laplace law.
Yeah.
Yeah, it's a globe, right? Therefore, when the thickness of the wall is more, you get the pressure also high. Therefore, due to this pressure, sometimes there are two muscles in the diaphragm through which this esophagus enters the abdominal cavity. Now, if there is some weakness in those two muscles, when the pressure is high, it gets separated, and there is a gap developed through which the stomach can go into the thoracic cavity. Then when the sphincter is displaced, as I mentioned before, you get this reflux disease. Therefore, sometimes it could be due to less fat pads inside. Very thin people also you can get, because these gaps are filled with fat. Some people, especially young girls,
They try to get
thin, quickly. They want to get thin, and they, fall into trouble, because when this fat get wasted quickly, you develop these gaps, and through which also you can get hiatal hernia. And also the other problem is that the sudden reduction in weight is there is a vessel going above the small bowel part, where the bile is traveling. Now, that vessel, that bowel is protected by the fat pad. When the fat pad is lost, this heaviness of this vessel can compress the small bowel, which get dilated, and that valve I mentioned won't close. Therefore, so bile reflux and that erosions I showed, you can get. Therefore, you have to have a moderate
body weight. So all these are interrelated somehow.
All are interrelated. Yes.
So finally, doctor, before we wind up today's program, would like to get some to-do facts at home, maybe some guidelines in order to maintain a good health when it comes to your digestive tract.
Yeah, actually drinking enough water is a very important thing, because water, and also some people drink a lot of water in the morning and just keep quiet.
Empty stomach sometimes to drink water. Is it related to this? Is it good?
It's so good. Actually, it's good when you get up in the morning. That acid is actually is collected little, and you can dilute it drinking water. But stomach needs water throughout the day. Now, this problem you find it in people who are working in air conditioned rooms, because they don't get thirsty, because perspiration is not there. Therefore, the water level in the blood is okay. Therefore, you don't get thirsty. But bowel wants water, because the acid secretion is continuously there. Therefore, when you don't get thirsty, you don't drink water. Then you can get gastritis, you can get constipation, all these things. Therefore, when you know that bowel wants water throughout the day, you have to actually consume it actually forcibly, time to time, because there are various things coming on Facebook and social media, water therapy, hydrotherapy, like that. Those all I think we won't recommend, because they recommend to drink lot of water in the morning, and that's enough. No, it is wrong, because the acid secretion is continuous, and those bowel contraction has to be there to push the things down. You have to have a frequent amount of water to be ingested.
So yes, do remember that you need to get the required amount of water daily throughout the day, not just in the morning. So we are going to wrap things up with today's session, as we were talking about gastritis and other conditions which are related to our digestive tract. So I would like to thank Dr. Ranil Jayasen for being here with us today, consultant gastrointestinal surgeon, to give you this information. So we'll meet once again on another segment of iMed. Thank you, doctor. Thank you for being with us today. Thank you, and you too have a pleasant day ahead.